Welcome back to my podcast. I'm here with Susan today. She's a public PT. Again, I'm continuing this series about things related to OBGYN and how we can all come together to help you guys learn and get through your pregnancy and just life in general.
Yes, first of all, thank you for having me here. My name is Susan. I'm a doctor of physical therapy. I specialize in treating pregnant women and postpartum women. I'm also a yoga instructor, so I love everything related to movement. I think that everything comes together when it comes to pelvic floor PT, and happy to be here.
Thank you. I find specifically in my field of obstetrics, they think they can get everything from me, but we do obstetrics and gynecology, and there's so many relating fields, especially when we're talking about obstetrics, because especially for a first-time mom, there's so many fields coming together. A lot of times the partners come in, most guys in general don't even go to the doctor. Let's be honest here. So they're coming in. There's all these health talks. There's, hey, you're about to have a baby, so you need a pediatrician. They need to learn how to take care of a baby. There's so many changes happening to your body. Um, and a lot of aches and pains start happening too, especially as your whole balance changes, the way you sit, the way you move. And a lot of times doctors will just write it off as saying, you're pregnant, don't worry about it. But there are things we can do during pregnancy and post-pregnancy to optimize that. I mean, yes, you may feel a little uncomfortable, but there's things you can do to make these things better. So that's really what I wanted to start getting into.
I completely agree. I will say that I haven't been by the way, everyone, I'm 36 weeks pregnant right now. So I've been lucky enough that I haven't been having those pains, but I've been very active throughout my pregnancy. And so I agree. Like, there are so many things that you can do in your pregnancy, not fear exercise, quite the opposite. Do more exercise to make everything feel good and work well. And so that also your postpartum journey is just so much easier that way.
Yeah, and I think there's specific things and types of exercises you can do before and after that can help better get you there. So actually, let's even start before then. Let's say you're young and you're thinking about having a baby. What are things you usually recommend people to do in preparation to getting pregnant to just be in the most optimal physical shape, specifically for your pelvic floor?
Okay, so if we're talking pelvic floor, I would say that the first thing is just to become aware that those muscles exist.
Hmm.
Understand what they look like. Like, a lot of people have no idea of what the pelvic floor looks like. By the way, I have here my pelvic model.
Yes.
The muscles in red are the pelvic floor. Anyways, when people talk about the pelvic floor, they think that they're referring to your glutes, that they're referring to muscles around the pelvis. And we're really talking about muscles inside or sitting inside the pelvis. And it's a group of muscles, not just one. So,
Hmm.
the first thing that I tell anyone that is thinking about their pelvic floor, thinking about their pelvic health in preparation of pregnancy, is to become aware that those muscles exist, number one, and begin connecting to them. Because before pregnancy, I find that that connection to those pelvic floor muscles is there, but you're not aware of it. And what happens during pregnancy and what happens during postpartum, especially if those muscles get weaker, which will probably get weaker because of all the things that happen in pregnancy and during labor, you lose that ability to connect to them without thinking.
Hmm.
And even thinking about connecting to those muscles becomes very difficult because you don't even know what they look like. So that would be the first thing that I would teach someone thinking of getting pregnant, and even in the beginning of their pregnancy when they come to me. So, connecting to the pelvic floor muscles.
I'm sure you'll relate to this. I don't know. On every well woman exam, I check their pelvic floor and their strength, and I'll ask them to Kegel and squeeze. And a lot of
Wow.
times they'll literally reach down and grab my hand, and I'm like, no, your pelvic floor, and or they'll like squeeze their knees together while you're pregnant, while your body's going through all these changes. It's better than waiting until you're about to push a baby out, but it's ideally beforehand would be ideal.
I mean, there's a lot of research showing how about 1 in 3 women, when it comes time to push their babies out, instead of pushing, they're contracting. Like,
Hmm.
there's this huge disconnection that obviously makes their job harder.
Yes.
and also increases the woman's risk of pelvic floor injuries during birth or the need to be assisted with any sort of instrument.
I know on our side we call it co-contracting, and there's a higher incidence in things like, for example, endometriosis. But I explain it as try to poop and stand up at the same time. That's what you're trying to do, and it's very hard for us while someone is trying to push to coach that, especially if they have an epidural and they lose sensation in their lower body.
Yes, and that's a lot of what we do at the later stages of pregnancy. I tell them, listen, you're gonna see your OBGYN's face and you're gonna think of pooping straight at them. And that's how we practice it. And they're like, but shouldn't I be thinking more about the front part? And I'm like, no, think of the back part.
On a side note, my dad will tell our Venezuelan patients, "I want you to push and smear."
Exactly. Exactly.
If you were someone coming to you before pregnancy, what tips and tricks would you give? Or what are like three things you would tell them to get prepared?
To get prepared for pregnancy,
Yes, let's start there.
like I said, first of all, look at images of the pelvic floor.
Hmm.
We're gonna connect to the pelvic floor. In order to connect to the pelvic floor, you wanna basically think of squeezing the back part of the pelvic floor. So
Hmm.
I would say think of this area, not so
Uh-huh.
much the front area. And you're gonna pretend like you're picking up a berry with your anus, not so much with your vagina. Like there's better
Hmm.
recruitment when you do it with the back part. So that would be number one tip for reconnection. I would also say go to a Pilates class, start connecting to your core, start to find out how your breathing relates to that pressure management system. I want you to start coordinating your breathing with your movements so you can better manage pressure in your pelvic floor. And if you have doubts, come back to me in terms of like how to breathe during exercise, because that's huge. Like one of the biggest things about pressure management in pregnancy and postpartum is learning how to coordinate your breathing with all these muscles of the pelvic floor that are so much connected to the core. So that would be my tip number two. And tip number three is buy a squatty potty yesterday, because everything starts in the daily habits. And I find that these women that have been constipated all their lives, for example, those are the ones that end up also having problems later on in their postpartum because they're constantly putting pressure and pressure and pressure on their pelvic floor. So we want to start addressing those daily habits to keep a good pelvic health or optimal pelvic health.
So bowel
Yeah.
habits are important, but also you kind of half mentioned it with like the yoga and the practices. But let's say they don't go to a class. What are things they can do? Like I know in yoga they talk about diaphragmatic breathing. What breathing practices would you recommend?
So, number one, stop holding your breath. I find that a lot of people, when they're doing effortful things, their tendency is to hold their breaths.
Hmm.
There's a lot of discussion around using breath holding in exercise like CrossFit and weightlifting, and that's a whole other topic. But for something as simple as an abdominal crunch, just don't hold your breath. Tip number two, every exercise or most exercises that we do have two parts. It has the eccentric part or like the negative part of the movement. Let's say in a squat, when we're coming down with that barbell in our shoulders, that would be the negative part of the squat. And it has the other part of the squat, the concentric movement or the effortful part of that exercise. And so, what I tell my patients is, as a rule of thumb, you want to exhale on exertion or exhale on effort. So, let's say that you have 100 pounds on your back and you're squatting. The hardest part of the movement is to bring that weight back up. Therefore, you're going to inhale on the way down and exhale on the way up.
And I think that has to do also with what you're trying to achieve. Holding your breath in a squat is great to build like intra-abdominal pressure to squat.
Exactly. And like you're saying, when we are holding our breaths, it should be because our muscles are not enough for us to create that intra-abdominal
Mhm.
pressure that will provide safety to our spine, for example. But if you're not doing max reps, if you're not working at the highest weight that you've ever lifted, you don't really
Mhm.
need to rely on those compensatory ways of stabilizing your spine. You should be engaging your core. You should be able to breathe. So that's a big one.
Yeah, we have to train for what the desired outcome, which is in this case pushing a baby out, not mix lifting max weight. And also, these are good
Exactly.
tips for just every human being on the planet to just have a healthy pelvic floor, male, female, to have better posture, to get the innermost part of your diaphragm, pelvic floor coordinated together.
Yes, and like you were mentioning, how do I teach someone to breathe? Because the diaphragm is connected to the pelvic floor and it's connected to the core. Basically, the diaphragm and the pelvic floor work together. When we inhale, the diaphragm descends, pelvic floor descends too. When we exhale, pelvic floor lifts, diaphragm lifts. And so, what I teach my patients in terms of breathing pattern is that we want to be able to recruit that diaphragm every time that we're breathing. A lot of us do not breathe with our diaphragm. We're breathing mainly with
Do this, yeah.
clavicle area, neck. That's stressful breathing. When you are breathing in your day-to-day life, when you're exercising, you shouldn't be relying on accessory muscles to breathe. You should be thinking of expanding both your belly and your rib cage like an umbrella in all
Mhm.
directions when you're taking an inhale, and the exhale should be passive unless you're doing strenuous type of exercise.
Mhm. So great. I think that's great advice. And just having a normal movement practice where you move your body through some sort of range of motion. I think running and stuff is really good, but I think just getting like strength in your muscles and lengthened positions is also super helpful personally. But let's say now you're pregnant. What things in pregnancy do you normally recommend through like what we call the antepartum phase to prepare and also just kind of minimize just pains and aches?
Yes, so I would divide it in two parts. I would say from week 20 to week 34, you're doing something different than in week 34 until birth. When you start showing a belly or
Yeah.
when you start to feel pregnant, that's when you want to start doing pelvic floor prehab. Pelvic floor and core prehab. I teach my patients in this stage if they haven't seen me before, because most people will only be motivated to see a pelvic floor therapist once they are pregnant. So this is the time where I test their pelvic floor strength, see whether or not they can connect to their core. And based on that, I teach them how to engage their core and pelvic floor during movements of pregnancy. I mean, movements of exercise, but in pregnancy.
Mhm.
So I really don't change their exercise routine. I find that if they've been active before, you just want to bring more awareness to that movement practice you have already and be super conscious of what feels good and what doesn't feel good, and making sure that when you are doing anything like lifting weights, running, etc., you're not experiencing any symptom of heaviness or in the abdominal wall any coning, which is showing you that there's too much pressure there when you're doing exercise. So we just educate them on that. And I also try to teach them on like how important it is to practice becoming aware of your pelvic floor and core in preparation for birth. So
Mhm.
like all that practice of pelvic floor related exercises will translate to labor. So
Mhm.
that's a big part of what motivates them to start working on that. What I personally do, which is what I've been teaching my patients, is that you keep your exercise routine, but you add twice a week 10 minutes of pelvic floor and core dedicated movements. So let's say that my exercise routine has lower body, upper body, and anything related to that. 2 times a week, I'm going to be only focused on pelvic floor and core. That doesn't mean that while I'm doing lower body and upper body, I'm not being super mindful of what's going on with my pelvic floor and core. That just means that I'm going to be extra mindful while doing those 10-minute short routines that will keep me connected to that area.
Mhm.
And I find that if you have a mindful exercise routine, that will help with the aches and pains related to pregnancy. Obviously, there are some things that are kind of difficult to treat, I will admit, like pubic symphysis pain. I find that it's one of those things that once you get it, what you want to do more than just addressing those muscle imbalances that might be there but might not be there is just finding ways to feel comfortable when you don't feel comfortable. Like, how are you sleeping? How are
Mhm.
you sitting? How are you walking? Because a lot of times it is kind of part of pregnancy, in my opinion.
Mhm.
Sometimes it can have a pelvic floor underlying issue. I find that sometimes people with pubic symphysis pain will have some tightness in their pelvic floor, and we can work on that. But sometimes everything looks pretty good and you still have the pain, and that's annoying. But I find that just modifying your exercise routine and modifying accordingly will help you a lot to stay active and stay with less pains and aches related to pregnancy.
Also, a few things. You said starting 20 weeks. That's mostly for people listening. 20 weeks, your uterus is about at your belly button. Before then, most people can function how they were before pregnancy.
Mhm.
Um, the other thing too is those muscles are going to get weaker, but the stronger they are, the longer they're going to last. And for especially like stabilization of your spine, like the pubic symphysis stuff, it might just be the position of the baby's head and genetics. But even if there's like a tilt in your pelvis or if it's sciatica pain, a lot of that I think can be really helped by just doing this prehab work beforehand. So, can you
Mhm.
give me an example or two of which exercises you would do and how you would do it? If you want, actually, like, if I was one of your clients, have me do it.
Okay, so go on all fours.
Okay, wait, this is going to take a little. I'll do it, but I have to figure
Okay,
out how to.
so we're gonna practice hugging the baby.
Okay.
I can show it to you before you do it.
Mm-hmm.
You're gonna pretend like you are zipping up a very tight pant and that you wanna lift your imaginary baby towards you.
Okay.
Exactly.
Mm-hmm.
So, my huge belly,
Uh huh.
you're gonna place your hands under your belly,
Mm-hmm.
and on the exhale, you're gonna think of bringing that baby up. And so I'm starting with my pelvic floor. I am bringing that contraction to my pelvic floor and then zipping up that contraction bottom up. But what you should observe on camera is that your belly button is going in and up.
And up.
Yes, and it should be on an exhale.
It should go on
So,
the exhale.
yeah, it should not be like a
Oh, I would have done that completely backwards. So you want it?
exactly. A lot of people want to inhale and suck in. It's not that. You want to inhale,
It's like
diaphragm.
it's like a bodybuilding like stomach vacuum when they do that really creepy thing where the ribs flare. Yeah.
Yes,
Okay.
and hypopressives.
Yeah,
Or like in yoga, we call it nauli. When we
oh, that's so
like,
crazy when they yeah.
I can do it, but not now, obviously.
You went from 36 weeks or so to like 20 weeks in a second. That was impressive.
And that's how it should look like. Like, you should be able to have enough core strength to lift the weight of your belt of
Mm-hmm.
your baby.
Uh-huh.
So you're gonna follow my cues. The
Mhm.
first thing that you're gonna do is inhale, expanding your rib cage and your belly and minimizing movement here. And as you exhale, you're gonna think of sipping a pant. And if that doesn't work, I'm gonna give you a different cue.
Let me start from the beginning.
Inhale, exhale, hug the baby.
Definitely more awesome when you did it.
Thank you. Another cue that might work, I find that especially for men, is imagining that you're bringing the two hip bones
Mm-hmm.
together towards the midline so that you're trying to bring them closer towards your midline on an exhale. Or another one can be just doing a pelvic floor contraction. Contracting your pelvic floor should engage your transversus abdominis,
Mm-hmm.
but for some people that doesn't really work. So you can try any of those cues, either bringing the two hip bones together or doing a pelvic floor contraction, imagining that you are lifting a berry with anus and lifting it towards your belly button. And it's also imagine that it's the opposite of bracing for, I mean, it shouldn't feel like bracing for weightlifting.
I feel like if a bar was on my back, I'd tip over because of those. Okay.
Okay.
By the way, just like we're talking about doing this 20 weeks, I really think this is helpful. Like now to learn it beforehand, I
Yes,
think it's helpful.
this is how you teach anyone
Mm-hmm.
to engage their deep core.
Yes.
So that's what I would teach someone at 20 weeks. I would also teach them how to contract their pelvic floor, and then I would teach them how to coordinate it with movement. So right now, you just learn how to isolate
Hmm.
the core pelvic floor engagement, but that doesn't do anything if you cannot apply it to
Got it.
day-to-day movements,
So it's
such
like
as,
rehab. It's like you isolate and integrate.
so you want to be applying this when you're getting in and out of bed, when you're coming up, lifting up, standing up from a chair, whenever you are carrying a heavy box, whenever you're exercising. So that's a huge part of pelvic health in pregnancy,
Hmm.
because it's all about managing intra abdominal pressure. That's how your pelvic health in pregnancy will stay as optimal as possible. And even though most of us think that only applies with exercise, it's really your day to day life where you want to apply it, not just exercise.
I think like extremes in life kind of brings out weaknesses. Pregnancy brings out the weakness in your pelvic floor because it is probably the biggest stressor to it that you're going to have in your life. So if there is any weaknesses, you'll know. And it's also just a good opportunity to prepare for that as well.
Exactly. Every time that I sneeze and I don't pee, I'm like,
Yes, little wins. It's all little wins.
I
Yeah,
haven't peed.
get popular.
And so that was the first half of pregnancy.
Hmm.
So from week 20 to week 34, we're mainly focused on maintaining as much as possible the strength of our pelvic floor and our core, even though we know that those muscles are suffering a lot.
Hmm.
After week 34, we change a little bit that mentality into birth prep mode. Birth prep mode means that we want to make sure that that pelvic floor can relax easily, that can be stretched easily. We want to make sure that the hips are mobile for all the movements that hip bones need to make in order to allow the baby to descend without obstruction. So that's what we do after week 34. And one of the things that I teach my patients is perineal massage. We really emphasize diaphragmatic breathing for pelvic floor relaxation. So instead of just inhaling and exhaling, contracting, I want you to really feel how with every inhale, that pelvic floor drops and relaxes and you unclench it. So that's one of the things that we do. We do a lot of hip stretches, like I said, for hip movement. And we also practice pushing. So we practice how can we relax the pelvic floor while pushing instead of contracting the pelvic floor while pushing. Because a lot of people, when they do Valsava, when they hold their breath, they contract the pelvic floor. So we want to make sure that that doesn't happen. And that's what I would that's what I would teach a patient after week 34.
Do you use any tools to help coach them?
I
What?
normally just use digital exam to assess whether or not they're contracting, but I do know that other practitioners use biofeedback, which tells you pressure there when they're pushing versus when they are at rest.
They've done some weird studies on the obstetrical side with ultrasound, where you can physically see it pull up, which is super interesting.
Yes, actually, I was reading yesterday, an article on how the size of the levator hiatus, which
Hmm.
is for people listening, where urethra, vagina, and rectum pass through. Anyway, so that size, you want to make sure on ultrasound or in any way that it's increasing when you are pushing. For a lot of people, that change is very little, and that increases your chances of birth related injuries. So, yeah, it would be great if we had ultrasounds available all the time and we could do that.
Yeah, usually muscles tear while they're contracting hard. So if they're contracting when there shouldn't be, then there's a higher chance of injury. So,
Exactly.
well, it's super cool. I've done it just like because I've taken ultrasounds before and just to check because when we examine people, especially if I have endometriosis, I'll have them see if they can push or not. There's some prolapse exams you can do specifically with an ultrasound. We're just really
Yeah,
lucky in our practice we have it available, so I figured why not.
yeah, that's amazing.
It doesn't
I
actually,
find,
yeah, it doesn't actually
yeah,
make a difference in practice.
most PTs in the US don't have access to ultrasound, but I know that in Australia
Hmm.
they do. And so it's pretty exciting because there are a lot of things that you can assess much better with imaging. And you take this
Hmm.
subjective aspect of things when you can actually see it.
Yeah, I think from a practical standpoint for what you're doing, it probably doesn't make a big difference. But I think if you wanted to actually measure the distance things move, it's way better. So I think from a research standpoint, and just to know if it's working or not, because the patient can see it on the screen, which is cool. But I think generally, if they know if there's any biofeedback, or you being the feedback as a therapist.
Yeah, and like you said, research for research it would be great because unfortunately we don't have much research as we would want to in terms of things to prevent birth
Yes.
related injuries and so on. So it would be helpful in that way. Unfortunately, it's so frustrating
Yeah.
because now that I'm pregnant, I'm like, I mean, to everyone listening, obviously,
Mhm.
Dr. Bitran is my OBGYN. And the first time I saw him, I was like, I just want to have a C section. And the reason why I said that is because, unfortunately, because we don't have that much research, I find that we, as women, we feel this sense of, oh, we don't have control, so much control over everything that can happen later. And it can be frustrating. I find that no one has control over anything, but it would be so nice to have more information.
Yes, and also we're talking about a few things. We're talking about a lot of learning how to do things to prevent things. But truth be told, a lot of these movement practices, it's unlearning from day to day life. So a lot of these worst birth traumas, specifically in these cases, are either because you are now learning to contract things when naturally you wouldn't. You normally, like, how many people can do a full squat and sit there? It's not very common. And most people, they needed their pelvic floor to move and just to sit in a squatted position. So there's a lot of retraining going on. So of course, if you're like when I'm doing an exam, like on a well woman, and I'm doing a pap smear or something, and I put a speculum in, the ones who complain that the pap smear is always the worst are the ones that are scared because fear causes constriction, and the constriction causes more pain, and it's a cycle. It obviously causes more pain because it causes more trauma to the tissue because the tissues won't relax. So a lot of these things I think really help, and if the education happens beforehand, I think you get better outcomes. And we, as you know, as a pelvic floor therapist, you know people can have pelvic floor dysfunction and issues after a C-section.
Totally. And that's why, but oh, I didn't say it here, but I totally changed my mind. I'm obviously going to go for a vaginal delivery. Like I'm saying, it's just
Yes,
me
I'm with
wanting
you.
control.
Yes, definitely. No, it's I married someone like that too. A lot of control. She's definitely my better half. And
Yes.
and it's true. And by the way, like historically, birth is something scary. Still, on a lot of notes, it still says for the due date EDC, which is estimated date of confinement, because like some places they literally would lock women into a cage and say, "I hope them and the baby came out." We've come a far
Yes.
long way from there. Okay, but birthing was a scary process, but it was also something. You're here because someone had a baby vaginally. Like this the advent of a C-section is quite new.
Exactly. Yes. And I'm also here because your job is to keep me and my baby alive, correct?
Hmm.
God willing, and to keep every woman that goes to you and their babies safe and healthy, God willing, and all of that. But then there's this other part that I find that we don't talk so much, or maybe we do, but we don't
Hmm.
talk about it so much with our OBGYNs, especially because most of them are men. And it's our feelings of in our bodies
Hmm.
postpartum. And that's just so important. And so I find that when I decided to go into pelvic health, it had a lot to do with that. And it's addressing that part of motherhood that sometimes we just accept, like, oh yes, it's normal to feel that way, you just had a baby. Or yes, it's normal to leak every time that you jump because you just had a baby. Welcome to motherhood, that's part of it. Or forget your old body, you had a
Hmm.
baby. I think that it's just so important that we can validate um, that feeling in women, and that we want to feel good in our bodies postpartum, that it's
For sure.
not just about, oh, thank God we're healthy, my baby's healthy. It's not, that's the most important thing, but there's also wanting to keep that life pre-baby in terms of how we feel in our bodies. And so
Yes,
So
and there
yeah,
are things in there, and I really want to do a whole segment, partly with you, with the physical part and the physical therapy part, but there's an emotional part, and there's a whole family structuring that changes postpartum. So there's a few things. Number one, immediately postpartum, things are not going to be the same. And there's going to be a grace period that you need to respect. A baby just came out of that pelvic floor. And but there, I think, was passed down a certain way that people would move naturally that would help rehab their pelvic floor. And if everything goes well, not have much damage or any at all. So, and a lot of that is genetic, but a lot of that is just part of the way we live our life. So, maintaining that as much as possible to moving forward to getting you back. Yes. Number two, there's a huge hormonal shift. Like I tell people, hey, you get pregnant and you're like, oh, my hair is beautiful. It's glowing. It's flowing. My estrogen is through the roof right now. And you're going from that to a complete crash in your hormones, a rise in prolactin. And now when it's like you're going to experience this because this is your first child, is it's just you and your partner. And now there's a complete restructuring in your relationship. Your libido change. You essentially go into menopause in every way,
yes,
shape, or form, and that's made because your body's going focus on this baby. So yes, it's like you want to maintain as much as you can. I tell people you need to do everything you can to maintain some sort of sanity, get back moving as quickly as your body feels ready, and we'll talk about how to do that in a safe manner. But then at some point you got to get your life back. And how can you do that quickly, efficiently without any long-term trauma? How do you get the weight off quickly? How do you get your body moving okay? Or else what happens, I see one pregnancy, 2 years later another pregnancy. Sometimes I see 4 5 6 pregnancies over a decade, and they never had any recuperation. So if we can figure out how to do that, or just seek the appropriate health, we can get you feeling exactly like yourself again without portraying this myth of your life's over, you had a baby.
exactly. And you bring up a great point, which is allowing things to heal naturally too. I find that a lot of us just rush into like, I want to get in shape, I want to go run, I want to do this, and like you're just delaying your healing when you're trying to rush it. They need to be better advised.
I have moms of like three, for example, mid 40s, and they come and they complain to me that they have no libido. And they're like, can you give me a pill? And I go, okay, tell me what your day's like. And they'll be like, so I wake up at 4, I work out, I take care of my kids, I send them to work, I come home and it's like 10 p.m. and my partner wants to have sex with me. And I'm like, how many hours of sleep did he get?
For
Because especially with people who are like very high powered and moving and moving and moving, there's a cost to everything.
I get that question a lot too because in my social media I speak about the role of the pelvic floor on sexual health, and one of the things that the pelvic floor helps you with is achieving orgasms.
Mm-hmm.
And there are so many people DM me like, Susan, I have a hard time achieving orgasms. Can you help me? The first thing that I ask them is like, okay, but let's just talk about your relationship. Like, what's going on? Tell me about what happens when you are trying to have sex with your partner or whatever it is, sexual activity that you're engaging. And most of the time, it has nothing to do with the pelvic floor, the same way that you're saying that most of the time, it has nothing to do with the fact that you are a mom. It's just the things related to being a mom in terms of stress, sleep deprivation, and
And it's,
so
it's
on.
very
So,
different in 2024 than it was in 1950. Let me put it that way. And there's a cost to that, and I think it's definitely worth it. Feminism is a beautiful, crazy thing, but we have to understand with every good comes a bad, and sometimes we just need to acknowledge it because I have too many patients come in going, refusing to hire help, for example, but they're working full time, their partner works full time, and I'm like, you understand your grandmother who's telling you this stayed at home, had her sister there, her mother there, taking care of a kid. Their body was allowed to heal. They're able to mitigate their stress better because of those things. They didn't have Instagram telling them that they're out of shape because they weren't created by AI, right?
I, I agree. And it's so funny. You sound just like my husband right now, but I agree.
So we're talked about to the 34 weeks, and then we kind of got off track. So in the second, what you call the second half, from 34 weeks till birth, what do you normally recommend people?
So, start doing perineal massage twice a week, just 5 to 10 minutes twice a week. Let's use this. So, here's your perineum.
Mm-hmm.
That space in between vagina and anus. So the perineal massage means massaging this area, but you do it internally. So I say to my patients, insert about one knuckle into the vagina. But when I say one knuckle, it means once you pass the labia. Because a lot of people, when you insert just one knuckle in, you'll still be too superficial. So you want to make sure that one knuckle is inside vagina to the perineal massage. And you're going to imagine that your pelvis is like a clock. So you have 12 o'clock here, 6 o'clock, 3 and 9. So you're going to be focused in between that 3 and 9 o'clock for the perineal massage. You're going to put lubricant and you're going to first do U-shape movements around this area internally. And then you're going to focus on just 6 o'clock, putting pressure down towards the anus. Then you're going to focus in that space between 3 and 6 and put some pressure that way. And then to the other side. How much time are you spending on each of these points? It's really up to what you are feeling. I recommend somewhere between 1 or 2 minutes, but if you find that when you press here, there's pain and that you cannot put so much pressure, start very low on intensity and then build that intensity as tolerated because you also don't want to be sore after these kind of things, but you do want to get to a feeling of stretching. So that would be the perineal massage. And a lot of people, they ask me, how am I supposed to do with this big belly? And I tell them that they need to buy
That was
something
my
like
next
this, which
question.
is a pelvic wand. And so what you do is that you hold the pelvic wand here. This is the only part that actually goes into the vagina. Because when they see this, they're like, what?
I don't get it.
This, and this is the way that you hold it. That's why it's more convenient because it helps you do it. So if you are laying on your back, you insert this way and you use the top part of the wand to put pressure downwards. Same thing if you want to do it in a diagonal, you move it this way and you push on this top part of the wand to put pressure on a diagonal. And a lot of, I mean, some people don't like to do it on their backs. They can do it in the shower with a little step to place a foot in there and then reach down with this. But this is super, super helpful. I find that without this, nobody can actually reach. I would only recommend doing it with your fingers if it's more to treat like a perineal scar, because
Mhm.
then you can actually reach with your thumb or so on. And it's a little easier when you can feel the area with your fingers than with the wand. I find that a lot of people get a little lost with this, but you gotta do what you gotta do. Or you can ask your partner to do it for you. So you teach them first 2 minutes with the U and then in each spot. So that twice a week would be number one recommendation. And it, even though the research for decreasing the risk of grade 1 or 2 perineal tears is, like this won't help with that, it will help you, or research suggests that it can help prevent
Mhm.
third and fourth degree tears, which are the ones that we really care about preventing. Like the other ones, they recover pretty
Quickly.
easily. Let's find out what happens
Mhm.
with me. I can't wait for my labor to be over so that I can speak from a different
Uh-huh.
perspective. But, anyways, that's number one. Daily 10 minutes stretching. And I can give you right now a quick routine where you guarantee that you're targeting every little area that you want to be doing. So, do you want me to show it?
I'll do it with
Like,
you.
should
Here, I'll figure this out. Yeah.
can you do all fours now?
Yes, I can figure this out. By the way,
Great.
I'm so it's actually quite mobile.
Perfect. Perfect.
Yes, look at me. Here,
Amazing.
put a little squat stuff over here.
The first movement that you're going to do is to open the pelvic inlet. So, to
Uh-huh.
do that, we want to make sure that our knees are wide apart.
Hmm.
Exactly. And our pelvis is slightly tucked in. So, you can move forward and back in this stretching. I recommend you do it for like 1 or 2 minutes in preparation for birth.
Hmm.
You can also do the variation where you open the pelvic outlet. So it would be knees closer together, feet apart, and you
Ooh,
do the
sorry.
same thing. I hate that one with passion. I hate it. It feels horrible on my body, but that's why I do it.
That's why you do it.
Exactly. So now you can go into a half kneeling position so that we can do something more like unilateral. So bring one foot forward, stay on your left knee,
Like on one knee.
on a lunge, but with your knee down. Exactly.
Crescent pose.
And
There we go.
exactly. And now you're gonna move that right foot a little bit
Mhm.
out to the side so that you are more in like I'm just gonna do it for you.
Yeah, do it with me.
Okay. Much easier.
Yeah.
Okay. So we can be here.
Oh, out this way. Like a classic squat type deal.
Exactly. And
Uh,
so this one helps you open that mid pelvis
hmm
because it's unilateral movements. I also love teaching the 90-90 stretch. So you would place
uh,
your legs in 90-90.
hmm
It's not lifting up so much.
Back. Oh, I feel that.
Exactly. So that we can stretch those external rotators of the
Mhm.
hip. One of them is a muscle of the pelvic floor. So super important.
I'm regretting the squats yesterday.
Good. And the last one that I would teach is just a hip flexor stretch. So half kneeling, tuck the tailbone, and move your hips forward.
And for this one, you kind of gotta flex the glute so you don't dump in your back.
Rotate the pelvis in, and that will help you feel a stretch in the front of your, in this case, left thigh.
All while breathing correctly, right?
So you want to make sure that while you're doing these stretches, especially the ones we were doing in all fours, that you are not activating through your pelvic floor. You want to be taking deep diaphragmatic breaths
So
and
it's
thinking exactly and thinking of lengthening the muscles around that area.
oh that one
hmm
sucks. That one sucks so bad.
Yeah, so
Yeah.
while you're doing it, you shouldn't be having the face that you had.
Yes.
Like you should
Breathe.
be exactly. You
Yeah.
want to
This
be
one.
doing it in a way that feels intense enough, but not so intense that you can't breathe into the sensation. And the last thing that I would teach someone in week 34 is how to push.
Uh huh. Let's do that.
Do you want me to also coach closed glottis pushing or just open glottis?
And we'll talk about the benefits of both. Because the only issue I have with open glottis pushing is most people can't do it successfully because they can't recruit correctly.
And then
So,
they feel so bad about themselves for and they think that oh this is why this happened and not really like you can have a perfect vaginal delivery with closed glottis pushing but if you can try open glottis it might be even though the research is not that great it might be better for your pelvic floor but if it's not working for your delivery for your labor let it
yeah.
go.
I find people, in my experience, have a lot better chance of doing it if they don't have an epidural because they have the connection to the
Feeling.
muscle, and then the issues are opposite. So when you have an epidural, a lot of times you have no reflex, and when you do have an epidural, you're very mindful of the stretching of the tissues, which if you're in control lets you push slower, but some people actually lose control
And
completely,
that's
which is
not
also
great.
bad because they'll push too hard. Where the
That
open glottal pushing is phenomenal, but the closed. But on the other hand, if someone feels nothing and I say push, they're like,
So, okay, let's start, I
mhm,
guess, with open bodies
mhm,
so that we can get it out of the way. If you want to have an effective push, that push needs to last a long time. You can't just be like,
mhm.
no, that's not getting your baby out. So, we want to make sure that that exhale is long. In order to have a long exhale, you have to have a long inhale, correct? Makes sense. So, the first thing that you're going to do is take a deep breath in through your rib cage, through your belly, minimizing the movement here because that will make you suck your belly in.
Shows you haven't done yoga in a while.
So it should look like at least a 3-second inhale, like this one. I'm going to show you real quick. Inhale. So all of it went to my belly. I'm going to do it again. Inhale, big belly. And so that's the first part, big belly. Second part is hard belly exhale. So you want to keep your belly hard while you're exhaling. What does that mean? That you want to have it big and hard. So you want to tighten your abdominals because that will help you create some pressure down there, but that you don't want to suck the belly in. A lot of people, when they are exhaling, because they've trained their their minds to always draw the belly in or suck the belly in when contracting their core, when you tell them use your core, they suck everything in. You want to do the opposite. You want to be pushing with your belly out, maintaining that belly hard as you push with your pelvic floor.
Similar to the vacuum thing that you were doing before.
The exact opposite.
There you go.
Exact opposite, because the vacuum that we were doing was
Pulling it.
drawing the belly in and up. And what we know is that when we draw that belly in and up, which is activating our deep core, that results in a contraction of the pelvic floor. We want to
Hmm.
do the exact opposite. We want to be using more like rectus abdominis, your six pack, the more superficial muscles of your core.
Hmm.
You want to be doing the opposite.
What I tell people when they push is kind of silly and stupid. I tell them, pretend you're a bottle of toothpaste and your partner just finished it. And that last little drop is the baby. There's no more toothpaste in the house. And you just ate a lot of garlic. You have to get that toothpaste out.
Exactly.
It's like a
Exactly.
rolling and squeezing. Hmm.
Doing sucking anything. You would be pushing everything out. You should feel that as you push belly out, that creates pressure on your pelvic floor.
Hmm.
What I also tell them is that during that exhale, to help you prolong the exhale, you want to make a sound. We go one by one and then we combine it together. But you want to be making a sound. That sound can be like a shh, or like a cow, like or or whatever sound comes out of your mouth, as long as it's not like a, because a cute sound.
The cow is cute.
Those sounds are not gonna help you relax down there. You wanna do sonido grave. I don't know how to say it in English, but basically, you wanna make sure that you're not doing a high pitch sound.
Hmm.
So you can do. I try to cue them with the shh
Hmm.
or with the blowing candles. I don't like the blowing candles. I don't find that it works for me. I like the shh or the cow sound. So if you deliver my baby, I'm gonna be doing the
Mooing.
cow
I'm going to try really hard not to laugh.
sound. I'll be laughing too. So that's the sound that I tell them to do. And then all while pushing with the pelvic floor. So the big question that they ask me is, Susan, but I don't know if I'm pushing with my pelvic floor or not. So you telling me to relax the pelvic floor online doesn't help me. So I tell them, okay, so you're gonna practice pushing and you're gonna hold a mirror and look what's happening there. And so I have this other model, a little bit more accurate. And what I tell them is, take a look at what's happening in your perineum when you are pushing. If you see that this is what's happening, that it's moving away from that mirror, that it's becoming more like,
Mhm. It shouldn't look like your vagina ate something sour.
exactly, it should look like this.
Yes.
Instead of this.
Looks like a
So
Sour
when
Patch commercial.
so when you're pushing, you want to see bulging here. And that's how you know that you're not contracting your pelvic floor.
Hmm.
To review, open glottis pushing, you take a deep breath in, try to bring it into your belly, make your belly big. Then as you exhale, tighten up that core, push with your pelvic floor and make a sound.
Got it. So it's like could also be like
No, no, no.
I was
I
gonna
was
say
going to
it
say,
could be like it could be like fire breathing in yoga where they go and they have like the
exactly.
yeah. Okay.
And practice it a lot, because obviously, if you don't practice it, when labor arrives, when it's time to push, you won't remember, you won't have the confidence to do it.
Hmm.
And for closed glottis pushing, same thing, but instead of exhaling, you're just gonna hold your breath and bear down for 10 seconds and picture that you want to poop on your OBGYN's face.
For telling you to close glottis push because the open glottis didn't work. But I
Exactly.
think if you practice it correctly, if you don't have an epidural, it almost always works. But sometimes it depends. Also, not every epidural is the same. Some epidurals allow you to feel pressure, some don't. And it's a blind procedure. So if you get one, the way it works on you, we don't know how it's going to be. So we just want more tools. That's all it is. And the closed glottis allows you to use the intra-abdominal pressure to help push the baby, especially if you don't have that same reflex. I know it's really controversial, and some pelvic floor therapists will be like, "Don't close glottis push."
I'm not like that. I prefer for that second stage of labor to be shorter
Hmm.
than for it to get so delayed that all that tissue gets, like edema and so on. That increases your risk of birth related injuries.
Yeah.
I don't have such a strong
Yeah.
opinion on that.
And like little side point, since we're talking about pushing, you talked about perineal massage. The only other thing that's really been studied to reduce third and fourth degree tearing has been warm compresses. So it's something you can always ask your OBGYN for. Sometimes I'm thinking about just getting a sous vide and patenting it for a warm compress machine. I think it would be amazing. So I might
That
be smart, right? And then sometimes also when you're pushing hard, human women have weird pelvises because we stood up. So the inlet of the pelvis is like this and the outlet is like this. Sometimes when that last cardinal movement, when the head's extending, sometimes I have the mom stop pushing and just the reflex of the baby coming out will deliver the baby. But to get the baby there, sometimes it requires a good amount of pushing and force. So that is why I think sometimes people say with an epidural, they tear more. It's because they're pushing harder than their tissue can tolerate, and the person with them during the delivery is telling them to push through that tension instead of allowing for a more slow controlled process.
yes, there's actually research against epidurals, which obviously no one should be against epidurals, but like saying how not having an epidural increases your risk of third and fourth degree tears as well as levator ani avulsions.
Hmm.
And it's in part because of, like you're saying, that pushing too fast, too quick, not getting prepped enough mentally and physically for the sensations of labor. And so as a pelvic floor PT, if someone tells me that they're not going for an epidural, I tell them you gotta get a doula,
Always.
because if not, you're increasing your risk of more injuries, even though you feel like it's the more natural way, the way that it should have been. You gotta be ready for it because you don't want it to take you by surprise, and then you wanna push that baby in 1 second with all your force because it's too intense, and then we have more problems.
To be honest with you, though, most of those people end up getting an epidural because usually by 4 or 5 centimeters, I can tell who's going to get an epidural by the way that they're breathing. So you'll see the people who can maintain like a sense of like a breathing pattern, and the ones who are holding, I'm like the ones that are holding, they're not going to dilate because their pelvic floor won't relax. Number one, and number two, they're going to exhaust themselves. They'll take a nap, which is fine. They'll get an epidural. They'll take a nap, and they wake up completely dilated magically. You know?
I saw it. I find it so incredible that the pelvic floor can have such a big effect on the ease of that baby to descend.
Mm-hmm.
A lot of people, they think, oh, in pregnancy I only need to focus on strengthening, but no, like you gotta make sure that your pelvic floor can also learn how to relax.
It's
And
function.
one thing I forgot to mention as one of the good things about open glottis pushing is that it does help you push for more time without getting that tired.
Mm-hmm.
So it's something worth trying, because the moment that you say, I'm done, I can't push anymore, that's
Mm-hmm.
when you have to help us. And ideally, you shouldn't have to help us
Mm-hmm.
get that baby out. One of the biggest benefits, in my opinion, of open glottis pushing, it will help you stay pushing for a little longer. I do find that that's a huge benefit of it.
I mean, to be clear, there are good reasons to use vacuum forceps or a C-section, but ideally the reason isn't because you're tired.
Exactly.
Yeah.
Exactly.
Right.
Exactly. Exactly.
We'll go there. So look, we did all these things. By the way, there's a few things. We talked about that epidural thing, about how people who didn't get an epidural tore less. We also talked about the people seeing you. Both of these types of people are people that are more health conscious, if you think about it.
What?
More like in tune with their body and health conscious. So I think that's a huge confounding variable. Someone who wants to take the challenge of having a baby without an epidural and someone actively seeking a pelvic PT likely have better pelvic floor health, or at least awareness to seek out help, which I think is really important to do this so people know at least where to get started and to seek help to begin with.
Yes, or they see me because they're having their second kid and the first experience what it was difficult for them. They found that they had a really hard time pushing, that every time they were pushing, their doctors were telling them like, you're not pushing.
Mhm.
And so then they come to me so that their second time experience is a little bit better
Yes,
population.
but they're also, I think a lot of it is because they're actively seeking that, and they're the thought of coming to see you or seeking this information isn't even on their radar, which is why I'm really happy to have you on today, which is great.
Yes.
But we're still not done yet. We got to go through all the postpartum. By the way,
Let's,
we're over an hour. I've been having fun, so if you're good to keep going, I am.
I'm totally fine going. Yeah,
Great.
let's
So
do
let's
it.
talk about this. You had a beautiful delivery vaginally, no instrumentation, baby's on your chest, crying. What do we do postpartum?
The first few weeks, it's just protect the pelvic floor. I say, like first 2 weeks be horizontal. You're not thinking of like doing crunches, going on walks, doing pelvic floor related stuff. Just focused on being a mom, rest, be horizontal, don't rush your healing, and so on. I do tell some of my patients that do feel like they have the mental energy to do something those first few weeks. It's just basic things like breathing, like 360 breathing, diaphragmatic breathing, reconnecting with the pelvic floor, just horizontal from your bed, not doing much. If you want to add in any movement, let it be so that your back feels better. Meaning, do some stretches for your upper back because you're breastfeeding, but you're not really doing anything else pelvic floor wise. I do tell them make sure to avoid constipation, which I'm pretty sure that you tell them too.
Mhm.
I tell them keep practicing that open glottis pushing when you're pooping so that you don't hold your breath and strain too much. Use the squatty potty. Minimize the strain that you're putting on that pelvic floor those first few weeks postpartum. I also tell them be careful of not going on, like, don't get too excited with going on walks early postpartum.
I don't
I hear like everything getting to the windows. Anyway, so I tell them try not to be on your feet too much. This is the time for allowing those organs to get back in place. Don't mess with it. Don't push your healing. So that's first 2 to 3 weeks postpartum. A week 3, week 4, we can start doing more pelvic floor things, still in horizontal. What does that mean? It just means simple pelvic floor contractions, simple core activation like we just practiced, like what I just taught you to do,
Mhm.
but maybe with like leg movements or in all fours with arm movements, just to start challenging your core a little bit, but in a very gentle way. Why? Because in my mind, I know that at 6 weeks, everyone is clear to exercise. I just don't want them to jump from 0 to 100 too
100%.
quickly. So that's the reason why I tell them you can start doing these movements to prepare you for that moment so you
Yeah.
feel a little stronger.
Yeah.
By week 5 or 6, assuming that you don't have symptoms, you can start doing more vertical things, meaning you can start going for shorter walks, like 15-minute walks. You don't want to be putting too much strain there, you want to protect the tissue. You can start doing by week 5 things like lunges or squats to a chair, but without weight, just to connect to that pelvic floor and core in different positions. So that
Mhm.
once you get to week 6, which is when they're clear to exercise, you feel more comfortable grabbing lighter weights and you progressively strengthen your body. But I tell them, listen, if you didn't do anything those first 6 weeks postpartum, it's not a
Mhm.
big deal. It just means that when you start exercising at 6 weeks, you want to go slow. You don't want to jump too quickly into movement. I tell them that all those habits that they learned in pregnancy for pressure management still apply to the postpartum time, meaning toilet habits, how to get in and out of bed, symptom management. Like if you feel heaviness, you lay down. If you jump and you pee, it means that you shouldn't be jumping still. I tell them this is how natural healing should look like. But if you find that you're kind of stuck in that every time that you do this, you feel that you're gonna pee your pants or you feel heaviness, then that means that you gotta take it a little slower. So it's always about listening to your body and being mindful of how you're feeling instead of rushing your healing, because rushing your healing means delaying your healing. So I like to teach them patience.
Yeah, slower is faster sometimes.
What?
Ironically,
Yes,
slower is faster sometimes.
always faster. Oh, and a big question that they ask me, and I'm sure that they ask you too, is should I be using a waist trainer postpartum?
Yeah, I get that a lot.
No, everyone asks me that, and I'm not against some level of support, but you want to make sure that it looks like underwear kind of support coming
Mhm.
from bottom up, not just
Mhm.
like imagine that your
Yeah.
belly is a balloon, your pelvic floor is here,
Yes.
or
Pushing it down.
exactly, you're putting too much strain on that pelvic floor, and you want to make sure that that doesn't happen. So if you're going to use any sort of support, you want to make sure that it starts from
Bottom up.
floor up. So I know that there are a lot of options out there, but don't just go and put a tight corset around your belly.
Yeah, so I kind of tell them something similar. I usually try to get them moving around the 2 week mark, mostly because I want them to do move just for mental health and also for them to see some sunlight. And I also tell them to take it as easy as possible. Don't think about what you're doing beforehand and get started and do basically the same sort of like breathing exercises and take it slowly. Uh,
Exactly.
I also want to mention that everything we talked about so far was for vaginal delivery. A C-section, I counsel them a little different. I do recommend the bands, and we usually put it on the scar, lifting up on the belly. And we actually even have people in the OR leave with that on because just getting used to being able to move is so key to be able to sit up and get
It
out.
helps with pain, and you don't really need to protect the pelvic floor as much.
Mhm.
So, I mean, you don't have to be so mindful about pelvic floor post C-section in that way. Like I wouldn't put something super tight on someone's abdomen if they just had a vaginal delivery, but if they had a C-section, I know that that will help them a lot with pain. And it will
Yes,
also help with healing of diastasis recti. And we know that people with C-section have usually
yes.
a wider gap.
At least below the belly button closes the muscle in the peritoneum. But remember, that means it was opened and now closed, and you don't want tension on those sutures.
Hmm.
So it does help them.
The way that I see, the way that I treat clients is just very individualized.
Uh-huh.
So there's not really a difference. We just take it by their symptoms. Like if any movement that they're doing gives them pain at the scar or pain after exercise, it means that we did too much. So I will be more conservative when it comes to core or how deep you go into any stretch. Like let's say that someone comes to me, they're like, oh, my back hurts so much because of breastfeeding.
Hmm.
I will probably guide them through a different stretch than the one that I would give to
Uh-huh.
someone who did vaginal delivery, because I know that when they're doing deep twisting, that will not feel good on the scar. We do, I mean, with a C-section, obviously, there's a lot of education on how to treat that scar to help mobilize that scar.
I get a lot of
So,
questions on scar massage. I usually recommend that they don't do it at least near the incision for the first few weeks. I've had patients even open the incision by starting too early.
yes, and I don't know. I mean, my rule is you don't touch the scar for 12 weeks. So it's some time.
Yeah.
Having said that, in the beginning, you can start doing things to desensitize it, like putting different kind of fabrics in the scar once it's obviously not like bleeding. Gentle. So if this is the scar, very gentle away from the scar, doing this kind of motions or circles away from the scar
Hmm.
and gentle.
Yes. And
And it's not until like week 6 that we can be a
yeah.
little less gentle, but still paying attention to how your particular scar is healing. And knowing that if you are doing everything well, like if you're breathing, if you're doing your little stretches, if you're mobilizing the surrounding tissue and so on, things will heal.
Hmm.
So like just be patient. You don't want to make it painful and delay things.
Yeah.
Just be patient, be gentle, and eventually you'll be able to really dig in that scar. So don't worry, because
Hmm.
you will be able to.
But there's nothing to massage. What people don't understand is there's nothing to massage out. And the two things that make a scar look good, number one is genetics. We can't fix that. Number two is taking tension off the incision. So by pulling on the incision, you can create a thicker scar. And what you're massaging first is there's a healing process. There's a lay down of a bunch of healing factors that needs to go down there, that need to settle before there's anything even to massage.
Exactly.
So yeah, I'm with
Exactly.
you. I don't like anything for 6 weeks as far as movement. And like you said, remember we close things to the belly button. It's better to start. There's sutures under the skin that will benefit from movement as well to help moving. Because some people will say, "Hey, as I reach up, they'll feel a tension in the fascia because of the pulling." So those are the things you want to address first, more than the superficial thing that you're saying.
Exactly. So that would be more like my C-section plan. And for vaginal delivery, if they do tear their perineum, we do something very similar to the perineal massage, but this time it's the perineal scar massage. It's just that you're going to be focused on the scar or any part around that area that feels painful. Pretty similar guidelines.
You probably just don't
And
even
we
want anymore.
after 6 weeks, like you shouldn't be massaging the scar before you're cleared to have sexual intercourse, which is pretty obvious.
And I've had patients have sex in the hospital.
Oh my god.
So, I mean, everyone's different. But my point is, if there's stitches there, you probably want to leave them alone.
Yes. Yeah, there's just no rush to healing. Like, I try to tell people that, of course, there's an ideal time where you want to start doing things to promote healing, but it doesn't need to be that early. Like,
Hmm.
at that time, postpartum, 2 weeks postpartum, you don't need to be doing 100 crunches a day.
Yeah.
Your diastasis will eventually heal. Obviously, you're not going to wait a year, because by that time,
Yeah.
you want to take advantage of the hormonal changes. For example, like that linea alba, which is what gets stretched during pregnancy. You want to take advantage of the fact that estrogen is dropping, that things will get stiff, and you want to approximate those muscles around the rectus abdominis. You want to approximate it to facilitate that narrowing of the linea alba, and more tension there. But you don't have to do that 1 week postpartum. You can wait a little bit. Um,
Maybe
so
one
yeah.
thing we'll talk about before we finish is what do you recommend people for every patient? I think I have a diastasis. I have a diastasis. I have a diastasis. And I'll examine them. Some I'm like, actually do have a diastasis. I can take 3 fingers and just all the way through. And sometimes there's nothing there. They just don't have function. So how do you diagnose a diastasis, and what do you do proactively postpartum to help
So
mitigate?
let me just start by saying that more than 80% of us by the end of pregnancy and early postpartum will have that like separation. It
Mhm.
has to happen. You have to accommodate a baby. So don't freak out if things don't look perfect in the beginning. For healing, well, for diagnosing, number one, it's more than just how wide it is. You want to also take a look at how deep it is. Ideally, you want something not so deep and narrow. Obviously, that's not the case all the time, but we can work on that. What I try to tell my patients, number one, is don't get so fixed on the separation. Don't get so fixed on it. I know that it sounds like something that you don't want to hear, but you want to first think of how deep it is. You want to be able to create tension there. And so, how do you fix diastasis recti abdominis? It's not by avoiding crunches. And I know that a lot of people, when they hear me say this, they think, what do you mean? We should be avoiding crunches because that's what makes it worse, right? Not really. So, I give my patients that come to me with diastasis recti a program for strengthening their core that is not just breathing. A lot of people think that, oh, to heal my diastasis recti, I need to learn how to isolate my deep core and just do that. Just sit and pretend like I'm hugging the baby, or go on all fours and hug the baby, and that will fix it, because when you activate your deep core, it closes the gap. And that's a lie. What closes that gap is engaging your superficial core, which is your rectus abdominis. So crunches will be part of your program. You will do crunches while breathing the way that we learned in pregnancy, though. So you want to do crunches while also activating your deep core, because that's also a big part of recovering and putting tension through that linea alba. Things to look out for when you're working out your core postpartum is something called coning or bulging. So a lot of people, they say that, oh, when I do a crunch, I see how, if this is me laying down and these are my six pack, I see something bulging in between that, which is basically pressure escaping on that weak point of your abdomen, that linea alba. So you want to watch out for that, but not necessarily avoid it. So, people, what the research shows is that if you have coning, but it's soft coning, meaning that you can put fingers and kind of like push it down, it means that there's not enough pressure pushing out to prevent healing. I don't
Mhm.
know if that makes sense.
Because if it's hard, you have too much stuff coming out that things can't come together. But if it's soft, that means you're okay because you have enough inward pressure to get things to come back together.
Exactly. You're going to start working out your core pretty hard. We want to get that strong. You're going to do it with my breathing cues to minimize how much pressure you're putting through that space that is weaker. But you are going to be doing hard movements, because I find that what happens the most in postpartum is that people are just so afraid of working out their core because they're afraid of making it worse. They are just their core doesn't look the way that they want it to look, simply because it's so weak,
Hmm.
not because of the separation. I see some people that come to me, they're like, I have the worst diastasis recti, and then I go measure and it's like two fingers.
Hmm.
And I'm like, listen, what's happening is that your core is weak. Things are still a little stretched from pregnancy. Let's just get you strong.
Yeah, and they end up getting more dysfunction from not using it, and it just they think they have a
I
diastasis because nothing's working.
fear that they're going to make it worse. And what's making it worse is just that they're not working on it. So, for anyone hearing postpartum, you should be working out your core kind of like the way that you used to before you were pregnant. Yes, I want you to be more aware of how you're breathing. I want you to be aware of also recruiting that deep core the way that you learned in your pregnancy. But don't avoid movements unless, like I said, you have heart coning, or unless you get any other symptom,
Hmm.
which you shouldn't if you're doing the breathing the way that we learned. So when you are doing a crunch or a sit up, every time that you go up, you're exhaling, you're drawing that belly in, but you are doing a crunch.
And also, if you engage your rectus abdominis and it gets thicker, the separation gets smaller.
Exactly, exactly.
Awesome.
And another big, a lot of people talk about the importance of rib mobility for managing diastasis recti. A lot of postpartum women, their ribs seem to be a little bit flared out, and that can put more tension out on that rectus abdominis and probably have an influence on that separation. So, working on deep breathing, rib mobility, thoracic mobility could also help decrease that separation. But that would be, like, not my priority. Those are things that you can do to help, but your program of core recovery shouldn't just be breathing, working on my rib mobility, and doing a little bit of deep core activation. No, that can be for the first 2 to 3 weeks postpartum, and then I would expect for you to challenge yourself more.
Got it. So I think it's important to think about it as well. There's some big things that matter, and there's some little things. There's, like most things, 20% get you 80% of the results. That other 20% are for the nerds out there like you and me who are just really interested and want to do it anyways. But I think overall, what I'm getting out of this conversation with you is, number one, learn how to breathe correctly. If you're pregnant, not pregnant, or if you're just a human being living on this earth, and learn how to connect to your pelvic floor. Have a normal movement practice where you can move through full ranges of motion, because that and being able to breathe will help you limit back pain and stuff throughout the pregnancy. And postpartum, we've got to respect the process. Slower sometimes is faster. If we slow down, we will be able to get back up to working faster and get your body back faster so you can enjoy all the things you used to before pregnancy.
And once you start working hard because you have no symptoms and so on, work hard.
Hmm. Love it.
Don't expect great results without hard work.
I think this was a great talk. We should do another one on not pregnancy related stuff. But if someone wanted to reach you, how would they do that?
So my Instagram account is Shed and Bloom. When we post this interview, we can share it there.
Awesome. We'll
Yeah.
do it. Listen, this was a lot of fun. See you soon.
Thank you. See you soon.
Have a good one.
You too.